The US healthcare system is the most expensive, confusing, and probably frustrating industry in the world. So naturally, Amazon wants in.
Amazon Web Services is extending its reach into healthcare.
It starts with a $3.9 billion acquisition of One Medical.
The only reason that we're in it is we think we can do it better.
But despite Amazon's big ambitions, historically, US healthcare hasn't been that friendly to so-called big disruptors. Big corporations like Walmart and Walgreens plan to revolutionize the system, but both have struck out big in the last couple years. Even Amazon themselves have seen billions in losses. So what's the deal? Do they think they could just outplay everybody else who's already failed, or do they know something that the rest of us don't? Companies don't usually blow billions without a reason. So I decided to dive in. I read numerous articles and Amazon shareholder letters, listened to earnings calls, and analyzed their early moves in other industries that they came to dominate. And I think I now have an idea what they'll do, and more importantly, what it means for the rest of us. Will Amazon make healthcare less expensive for US consumers and employers? Should we even trust them with healthcare data given their other businesses? That's what this video is going to dive into. Let's get started. Most people think Amazon only recently started to care about healthcare. That's not true. Their first swing came back in the late 90s when they took a 40% stake in drugstore.com, an early online pharmacy trying to bring prescription drugs to the internet before most Americans even trusted the internet to buy books. Amazon's bet didn't turn into a health empire, obviously, and Walgreens bought the company and a few years later ended up shutting it down. And for a long time, Amazon kept their healthcare ambitions on the back burner. Until 2018, when they entered this space with two corporate giants, JP Morgan and Berkshire Hathaway. They launched a joint venture called Haven. With 1 million employees between them, the goal was to make healthcare cheaper, simpler, and more transparent for those employees. These were three of the most powerful American companies. If anybody could figure it out or have the money to figure it out, it would be them. Behind the scenes though, the alignment fractured pretty early because they couldn't agree on the incentives. Failure number 2 for Amazon in healthcare. That same year though, Amazon made a very different kind of move. It bought PillPack, a startup that mailed people pre-sorted packs of their prescriptions, making it easier for patients to stick to complex medication regimens. And it actually solved a real problem. Every year, thousands of Americans end up in the emergency room or a hospital because they don't take their medications when they need to. It also gave Amazon something strategic: a national pharmacy license. PillPack eventually became Amazon Pharmacy, folded into the main Amazon app, delivering prescriptions like anything else you would order on Amazon. In 2019, they tried again to reduce healthcare costs for employees, this time with Amazon Care, a hybrid model that mixed virtual visits with in-person follow-ups. Originally was intended just for Amazon employees since they have so many, but they ended up expanding it to other companies as well. But scaling it nationally meant navigating provider networks, regulations, and the insurance mess. So by 2022, Amazon shut it down, their third failure in healthcare. Following that, they decided instead of building a clinic network from scratch, they're just gonna buy one. That brought them to their biggest healthcare acquisition yet, One Medical, a $3.9 billion deal for a network of primary care clinics, a telehealth platform, and a membership-based model that already had traction in cities like San Francisco and New York. Within months, Amazon began bundling One Medical discounts into Prime. Then came Amazon Clinic, a cash-pay service for common conditions like pink eye or sinus infections. So all of this is adding up for Amazon, but not in terms of profits. In 2023 and 2024, they lost over $2 billion combined. So why does Amazon keep coming back to healthcare even when it doesn't seem to pay for them? We'll dive into that, but before we do, I think we should look at Amazon's playbook to take over an industry, to see if that's what they're doing here with healthcare. In my research, I listened to a podcast with Amazon's chief medical officer for their pharmacy, Ben Gupta, and he said something interesting.
I'll be blunt. I think the lazy take is, oh, Amazon's coming for our lunch in X industry.
Well, I didn't want to be lazy, so I decided to research how Amazon does take over an industry to see if that's what they're really doing with healthcare. Across retail, cloud, logistics, media, and devices, Amazon does follow a similar playbook. They start by targeting a huge market that is filled with friction. In their other industries, that was shopping delays, complicated infrastructure, clunky interfaces, high costs. Then they go to work on those. Step 1 is obsess over the customer. Amazon's first principle is always the same. Start with the customer and work backwards. In retail, that meant lower prices, faster shipping, and infinite selection. In cloud, it meant making complex infrastructure accessible to startups. Entertainment, bundling media into Prime to increase value with minimal friction. Wherever Amazon has gone, they try to erase pain points and then build habits. And in healthcare, they are starting to do this, just not deeply yet. Simple apps, fast pharmacy delivery, and flat pricing are improvements, but the true pain points of care, billing, insurance scheduling are still largely untouched. Step 2, invest early, accept losses, and go long. Most big companies have to optimize for quarterly profits and long-term growth. They have to try to find a balance between the two. Amazon doesn't always work that way. The goal isn't to necessarily make money on day one, it's to make sure you never leave. And in healthcare, they are doing this. Step 3, acquire what they can't build fast enough. Amazon does build in-house, but they also acquire a lot of different businesses. And in healthcare, they are following the same pattern. Pillback gave it a pharmacy license, and One Medical gave it clinics and a working patient model. Step 4, create flywheels. This is what they're known for. This is what they're famous for. In healthcare, it does look like that flywheel is just beginning. Clinics feed into pharmacy, pharmacy feeds into Prime, but the loops are early and not yet spinning at Amazon's normal scale, so it's hard to tell for sure. Step 5, make it a platform. And in healthcare, this hasn't happened at all yet. Amazon's tools are consumer-facing, but there's no platform yet for clinics, payers, or employers to build on top of. And the last step, integrate everything. This kind of goes with step 4, but nothing stands alone for Amazon. Amazon's ecosystem is designed to loop back on itself. You buy a Kindle book, it shows up on your Fire tablet. Your Alexa recommends the audiobook, and it's discounted through Prime. In healthcare, that integration is partial so far. Prime discounts do exist, prescriptions live in the Amazon app, and the clinic access is bundled, but the health stack doesn't yet feel like a core part of the Amazon flywheel. So in summary, are they following the Amazon takeover script in healthcare? Kind of. The building blocks are in place. It's a massive market. I believe it's probably the most friction-filled industry in the world, and Amazon has made some major buys. Amazon's laying the foundation, no doubt, but whether it actually fixes healthcare or just reroutes most of the excess money into its ecosystem is still to be determined. Let's dig into that next. So will Amazon make healthcare less expensive for US consumers and employers? They could, in limited ways right now. What Amazon's doing doesn't attack the cost drivers that make US healthcare so expensive. They're not even touching hospital consolidation, insurance billing complexity, or price gouging from pharma middlemen. Instead, right now they're targeting areas that they can work around the system. Direct pay pharmacy, flat rate clinic visits, and employer paid membership models like One Medical. For healthy consumers with simple needs, those services are often cheaper and faster than traditional options. So that's a cost improvement, but only for relatively simple, low-risk care. It's estimated that the most expensive 5% of patients account for nearly half of all US healthcare spending. And Amazon has very clearly avoided that part of the system. They're not managing chronic care, surgeries, ER visits, or hospital admissions. And they probably don't want to because the regulations are a lot tighter and complexity is high. So yes, Amazon might lower costs for some US consumers and some employers, some of the time, but as a system-wide fix, no way. But we still have another question. Should we even trust Amazon with healthcare data? Amazon says that they silo health data from the rest of the company, that they follow HIPAA, use encryption, and don't sell data. Legally, that's probably true. Don't quote me though. But Amazon's real advantage is going to be to use the data to sharpen its ecosystem. If you take medications, that might say something about your habits. If you use a service like One Medical or Amazon Clinic, that gives some behavioral signals. Even if that data is technically walled off, it might influence how Amazon pushes or invests in certain products. And honestly, the biggest play here is that if they get you to use them for something health related like medications or One Medical, you're probably not going to leave their ecosystem. You're probably a Prime member for life. We'll keep tabs on their healthcare moves going forward. If you found this video interesting and you'd like to see more, please consider subscribing. This is Tyler Takeover. Thanks for watching.